Welcome to Deserve 2020, A Better Tomorrow Today, a virtual conference. Thank you for joining us today and being with us part of this conference this year.
Thank you for inviting me.
Will you tell everyone at home, where they are watching, who you are and your profession, who you are and what you do?
Well, my name is Debbie Hagins, and I am the clinical director of a Ryan White Center here in the Coastal Health District. And I live my life on purpose. And when you live your life on purpose, you walk with purpose. So I step into my destiny each and every day.
Man, when you talk about your purpose, so for you, when did you know that this line of work was for you, was a part of your purpose, your journey?
Well, if you're talking about medicine, ever since I was 5, I did know I was going to be a doctor. When I was 12, I knew I wanted to end suffering in the lives of people whom I could do more for them than they could do for me. And then, of course, once I hit my training and had a moment in the emergency room with a young man who came in with what we found out to be advanced AIDS. He was my classmate, and I had to pronounce him dead within 24 hours and tell his parents. I knew that somehow HIV and AIDS in my life were going to intersect. So I've been very, very fortunate to be the medical director of one of the largest HIV centers here in the Southeast region, working with a wonderful and fantastic and compassionate team of healthcare professionals caring for people living with and affected by HIV and AIDS.
And is a lot of people have told stories about for them when things hit home that somehow it's kind of you knew about it, you heard about it, this is what brought you into it. So when did you know you were passionate about it, or where did the passion as well come through for you for this type of work?
Well, I'm not going to say that I knew someone immediately in my family, but I do have family members living with HIV and who have succumbed to the illness prior to the onset of the medication that we have today. But it was around 2 or 3 o'clock in the morning when post call shift that I was leaving the emergency room and just had that moment that I was going to come in contact with, at the time was a deadly disease, and I would never be harmed from it, but be able to help. So again, I go back to that moment when I had to pronounce my classmate dead from advanced AIDS in 1990. That's when I knew.
In 19, that was 30 years ago now, we're in 2020, and you spoke a little bit briefly that so many things have advanced since then. It was harder, or people were still learning how to treat it and different things then.
Right. Well, there was a lot of fear of the unknown. And I met my first HIV positive patient as a medical student at Greater Hospital in Atlanta, Georgia. And at that time, we treated individuals like they were contagious. And we wore gloves, 2, 3 pairs of gloves, masks, disposable gowns, disposable stethoscope, and we had many effective treatments at the time. And we still had not understood transmission and things like that. So now we launch ourselves into the 21st century where we have well over 30 different medications. People living with HIV can live well 50, 60, 70 years past their diagnosis. People are not even dying from HIV-related causes if they come into care soon enough. They're living long enough to have everything that if they didn't have HIV, they would get. And more people now, unfortunately, dying of cardiovascular disease and cancers. So we have come a long way, baby, as they say in that little cliche commercial.
And a part of that coming a long way, along with definitely medicine and education and different things, but the conversation surrounding prevention and care is still relevant. Why to you is that conversation about prevention and care now still relevant?
Because we can conquer anything that we're willing to confront. And we need to continue to confront HIV on every side. We need to have all the community engagement, all the community outreach. We need to be, in the places where HIV tends to still not be fully understood. college campuses, high school, middle school, churches, at family reunions, and our sororities and fraternities. We need to have the conversation that this is a disease, this is a one-time, a global pandemic, not like it is now, but something that if we are willing to confront and attack, we certainly can defeat. I believe that.
And with the various different people, what is one thing that you feel that every individual can do to stop HIV?
Every person needs to know their status. If you're negative, learn how to stay negative. If you're positive, you're also part of the solution. So I think that if we see ourselves as part of the solution, even that we sometimes we don't want to be part of the problem, put it that way. We need to be part of the solution. We are part of the problem, part of the solution. So everybody needs to be a part of the solution and learn what their role can be.
And this is probably kind of, we're not backtracking, but for a medical or definition term, but what is HIV? And then do you believe that we can end the pandemic, the epidemic?
Right. Well, HIV in medical terminology stands for human immunodeficiency virus. And the word there, of course, is human, as human adaptation of a virus that can specifically target a person's immune system. And if left untreated, in most individuals will progress to an advanced state of severe compromised state of their immune system, and then of course they succumb, of course, to other diseases that otherwise they might have fought off. It certainly is not spread by mosquitoes or other vectors. It really is human to human transmission in very, very close contact, with most individuals becoming infected from another person who has HIV, either they are unaware or aware, and also from IV drug use. And then, of course, there is mother to child transmission, which, of course, in this country we have done an outstanding job of preventing the unborn from being born with HIV.
And I think it's the World, I want to say World AIDS Organization, I believe. I know I read it online, but one of their goals in the next 10 years is to end the epidemic. So do you believe that that is doable, that we can do that?
I believe that we can achieve such a low rate, and I think about the war against smallpox, and it was called death of a disease, and the whole globe got together and said we're going to eradicate smallpox from the human population. Now we still have little cases here and there, but if we have the national strategy in place of 90-90-90, where 90% of people know that their status, 90% of them engage in care, 90% of them unattackable, then it's those individuals who don't know their status are responsible for at least 50% of all new infections. So being able to achieve that globally while we're still searching for the cure, yes, we can do this. United we stand.
Yes. And I want to share this quote here. I dream, speak, and receive victory. When you hear this phrase, what first comes to mind?
The very first thing that came to my mind was a song that Donald Lawrence recorded entitled I Speak Life. And in the song, he sings, I speak life, you're gonna live, my brother, my sister, and don't give up the fight for your life. And he also mentioned about the fight against HIV and AIDS. That's the first thing.
Thank you so much, Dr. Hagins, for being here and being a part of this conference, and more importantly, for the work that you've done over the years.
All right. Can I say one other thing?
Oh, yes.
All right. So a second thing came to my mind at the same time, and that was my dream job of being a Star Trek doctor.
Okay.
And even though this is a fantasy world about ending poverty and war and discrimination on a galactic level, universal, but even in the United States, the author of that show had a vision that one day in this country and in this world, we would be able to not only eradicate poverty and stigma and injustice, but that every human being, life have value, and they deserve the best medical care that the universe had to offer, regardless of health insurance and income and things like that. I'm a Trekkie. So being a Star Trek doctor, of course, is just an imaginary position, but I think that if we strive for something, even if we never reach quite that, we'll come somewhere closer, we get further along than if we do nothing.